This has been looked at in a study carried out by O'Grady and Associates and published in 2009. And this was a retrospective study, but nevertheless, it tends to correlate with findings in people with the use of ACE inhibitors in heart disease due to dilated cardiomyopathy, but prior to the onset of failure. And what you see in this bar graph is that Doberman pinschers which did not receive an ACE inhibitor are compared to those that received benazepril. And there are approximately 100 dogs in this study. And you can see there that the median days until clinical signs or death was significantly greater in those dogs which received benazepril, almost 100 days longer. So it is generally felt that ACE inhibitors are a treatment of choice in dogs with dilated cardiomyopathy, but prior to the advent of congestive heart failure. As we've already stated, through a number of trials, the live, the bench, and the first trials, respectively looking at enalapril, benazepril, and imidazopyl in placebo-controlled double-blinded studies, that RAS activation is harmful and suppression of RAS activation with ACE inhibitors is beneficial. And what I want to point out from this slide is that in the live trial, approximately 40% of the dogs had dilated cardiomyopathy. In the bench trial, approximately 25% of the dogs had dilated cardiomyopathy. And in the first trial, approximately 25% of the dogs had dilated cardiomyopathy. So our data is probably somewhat less strong for dilated cardiomyopathy than mitral insufficiency. Most people believe that ACE inhibitors are useful in this disease after the onset of congestive heart failure.